Hello, I'm Dr. Greg Place. I'm Chairman of Nottinghamshire Local Medical Committee, and I've been asked to say a few words about the role of the Local Medical Committee and its committee members. We are representative of our profession. The Local Medical Committee is the body that does this and has done this since before the NHS actually started in 1948. It's been there a very long time. And we are representative of our GP colleagues, and we are voted to be on the committee by a democratic process. We are there for advice, and we're also there to offer advice to other bodies, and that may be other practices, our primary care networks, CCGs, NHS England, and even on a more wider regional and national basis as crops up from time to time. And it's a way of being involved in local decision-making about healthcare. This is how I got involved in the first place. The Local Medical Committee was a body completely unknown to me when I was a trainee, and I was asked to come to a meeting by my trainer at the time. And I found that they were discussing things at a level I had no idea that GPs could be involved in. How are decisions made? How do funding streams flow? How does general practice get to where it's got to? How is it organised? How are decisions made in terms of where it then goes next? And I found that really interesting and really important. So rather than just working in the health service, this was a way of being involved in decision making about where we were going and how to make the process better for ourselves, for our practices, for our employees, but most importantly, for our patients. And I think being a member of the LMC means you need to be prepared to learn. I've been learning all the way through my professional life, certainly, but also to offer advice, to give of your time, of your expertise, of your expert knowledge. And many people come to the Local Medical Committee with a particular knowledge base, and they have experience of things that other members don't. And it's really important to share that knowledge, and we all learn by doing that. As chairman, I've learned ever such a lot in my time with the Local Medical Committee. I came to the process, I think, with a fairly bare knowledge base. I leave the process hopefully with a much wider knowledge of how the process works. But as you learn, you realise there's more you don't know. And I think that's where the committee comes in, because the knowledge within the committee is vast. No one can really hold all that knowledge in their head, and that sharing of that knowledge in a committee structure is really, really important. Leading has been something that never really came naturally to me, and I found myself as chairman of the Local Medical Committee some number of years ago. But I think I've learned an awful lot by being chairman about how things work, how structures work, how we need to let people share thoughts, share decision-making. And I think I'm better for it. I used to be quite shy and retiring, believe it or not. And I think being on the Local Medical Committee does do quite a lot for you. It gives you a sense of purpose. It enables you, I think, to stand up and be counted, and feeling that your decisions, your thoughts, your ideas are worth something. It can be uncomfortable at times, I have to say, being in the chairman's role. You need to be prepared to try to control how meetings work. And I have been given some rather unpleasant jobs in my time as well. At a more regional basis, I've been the Local Medical Committee representative at the performance panel. And sometimes we have to make very uncomfortable decisions, which make a big difference to people's lives. But someone needs to do these jobs, and I think that may well be one of the roles for the next chairman, although that remains to be seen. So that's my thoughts about the Local Medical Committee. It is a crucial structure, I think, within the NHS. It is absolutely essential to have a representative body for general practice. If you have further questions and anyone isn't clear about particular roles within the Local Medical Committee, I always say that ask the Secretariat, ask the committee members, talk to the chairman. I think as committee members, we should be ready and willing to take questions and share thoughts and ideas with others. So please don't hesitate to come forward if you feel you have something to offer the medical committee in the future. Thank you.